Okay, and Delisia, you are up. If you want to share your screen, the floor is yours.
Great, thank you. I was actually trying to turn my video on, but it looks like since we had to go out and come back in, it has stopped working. So
Okay,
y'all won't be able to see me. I'm sorry.
no worries. Yeah, I'm not sure what's going on with our whole situation here, but it's great to hear your voice.
Yes. Okay, about to share my screen. Give me a second. Pull it back up. It's crazy because it worked a second ago and now I'm having issues.
I know. We had everything set up in that last Zoom and it was all working perfectly. And now, of course, we're having issues.
Okay. Are y'all able to? No, not shit. Let me see. Okay, here we go. There we go.
Perfect. I see. We are in.
Great. Okay. So thank you, Christina.
Yes.
As she said, I am Delisia Chapman. I am a graduate student in the School of Public Health. I'm currently a graduate student in the School of Public Health, with a concentration in maternal child health policy and leadership. This is my internship semester. So this past semester, I have spent interning with the Division of Adolescent Medicine with UAB, and I spent some time within the Adolescent Health Clinic. And so during my time there, I got to attend clinic and see patients with Dr. Hill. And so I chose this topic because as I attended the adolescent health clinic, I was able to observe many different challenges that the adolescent endure. And I never fully thought about adolescents having HIV, but I was able to see that, and it made me want to learn more. So today I will discuss with you all what HIV is, any misconceptions about HIV, the state of the HIV epidemic in the South. I'll provide statistical data of HIV in the South, provide you some factors driving the HIV epidemic in the South, addressing HIV in rural and suburban communities. I will give you some strategies towards ending HIV, the impact that HIV has, and HIV in the youth. So HIV is a virus that attacks cells that help the body to fight infections. It is spread by contact with certain bodily fluids of a person living with HIV and through sharing injection drugs equipment. It is most commonly spread through unprotected sex. So I'm sure many of you have heard of some common misconceptions about HIV. If you would take a moment to put some of those in the chat, we'll see what they think about some misconceptions are. Okay, so I got one that says I can get HIV from sharing utensils, that you can get it by sharing drinks. Get HIV through saliva. You can get HIV from kissing. HIV is only shared through homosexual sex. Okay, so yes, so all those, yes, I would actually be talking about some of those, but all those, yes, are misconceptions, and you cannot get HIV through those ways. So my first misconception is HIV will automatically spread to an unborn baby. In actuality, a woman who is consistent with her HIV medicine early in her pregnancy has about a 2% chance of passing HIV to their baby. The next misconception is you don't have to use a condom if both partners have HIV. In fact, safe sex is still important. There are different strains of the virus, and an individual could become infected with a type that they do not already have, or one that's more drug resistant. There are also other STIs that you can still get. The next misconception is unprotected sex is fine since we both tested negative for HIV. In reality, there are several ways to get tested for HIV. The most common is an antibody screening test in which doctors test for how many antibodies your body makes to fight the virus. But it takes your body a while to generate those antibodies. So there's a window of time in which you could have the virus and still test negative. The next misconception is HIV cannot be transmitted through oral sex. Actually, there is the risk for transmitting through oral sex is lower, but there is still a risk. The risk is high if the individual has open sores or cuts on their genitalia or mouth, bleeding gums, or if the skin comes in direct contact with semen. The next misconception is HIV can be spread through saliva, sweat, tears, and toilets. In reality, HIV can only be spread through semen, vaginal fluid, blood, or milk from a person living with HIV. The next one is you can get HIV from mosquitoes or other insects. Actually, there is no evidence of mosquitoes transmitting HIV. HIV does not reproduce and cannot survive in insects. The next misconception is you can't spread the virus if you're taking antiretroviral treatment. The truth is the antiretroviral treatment can reduce the amount of HIV in the blood where it is undetectable in the viral load test, but that only occurs if you are taking the medicine consistently for at least 6 months. And the last misconception is HIV/AIDS is a death sentence. Actually, individuals with HIV are assessing treatment that allows them to live long, healthy lives. HIV in the Southern United States. The Southern region, as you can see, expands from Delaware to Florida over to Texas, and currently experience the greatest burden of HIV and deaths of any US region. In 2018, 19,422 people were newly diagnosed with HIV and 462,785 people living with HIV in the South. In 2018, approximately 7,383 people died from HIV in the South. HIV epidemic in the South. Approximately 52% of new HIV cases annually are accounted for within the Southern states. 8 out of 10 states with the highest rate of new HIV diagnosis are in the South. The majority of HIV diagnoses in the South occur in urban areas like Birmingham. African Americans are proportionately impacted, accounting for 53% of new HIV diagnoses in the region in 2017. African American, same-gender loving, bisexual, and men who have sex with men account for 6 out of 10 every 10 new HIV diagnoses among African Americans in the South. Fewer people with HIV in the South receive timely medical care or treatment. Mortality in the South is high. In some Southern states, people with HIV have death rates that are 3 times higher than people with HIV in other states. In 2018, the South accounted for nearly half of the 15,820 deaths of people diagnosed with HIV in the United States. Newly diagnosed cases in the South. So as you can see from the chart, males accounted for the majority of newly diagnosed cases in the South. Adolescents aged 13 to 24 years old have the second highest rate of diagnosis within the South. As you see from this chart, that for male transmission, male-to-male sexual contact has the highest transmission rate at 81.3%, and for female transmission rate categories, the highest transmission is heterosexual contact, which is 76.8%. HIV prevalence is the amount of people living with HIV. Even though 13 to 24-year-olds have the second highest percentage of diagnosis, they still only account for a small percentage of people living with HIV. This is due to the effective medicines that are available that allow for the other age groups to be able to live a long, healthy life, but adolescents are getting diagnosed at a higher rate. A late HIV diagnosis is defined as having an AIDS diagnosis within 3 months of initial HIV diagnosis. approximately 4,000 cases were diagnosed late in 2018. With the advancement in medications and the ability to get tested, people should not be getting diagnosed late. As you see from the figure, the majority of people passing away are people who are 55 and older. This is due to the advancement of medications and not receiving late diagnosis. However, even with the advancement in medication, there are still disparities within the African American and Hispanic Latinx population due to them having a high rate of mortality. So this chart shows the difference of HIV mortality within the southern region in the United States. So as you can see, from 2016 to 2018, the South has had a higher mortality rate over the United States each year. It has decreased, but we are still above the United States. So factors driving the HIV epidemic in the South, there is high poverty rate and low median household income. Approximately 50% of all Americans who do not have health insurance live in the South. The largest source of coverage for people with HIV in the United States is Medicaid, but 9 out of 6 states in the South have not expanded Medicaid. Access to consistent HIV prevention and treatment services and HIV stigma. The federal government proposed the Ending the HIV Epidemic to provide funding to 48 counties with high HIV rates and 7 states with high rural HIV rates. 24% of new diagnoses are in rural or suburban areas, which you can see includes the state of Alabama. HIV rates for rural and suburban areas are higher in the South and Midwest compared to the West and Northeast. So I've provided 4 strategies that will help to end the HIV epidemic. And the first pillar is diagnose, and we'll diagnose all individuals with HIV as early as possible. Early detection coupled with rapid linkage to care is critical and can lead to improved individual and community health outcomes. Improve more accessible and routine health testing immediately, connecting people with HIV to care services and connecting those who test negative to appropriate prevention services are important activities supporting this strategy. The Center for Disease Control, Health Resource and Service Administration, Indian Health Services, Substance Abuse and Mental Health Service, and other agencies are working in collaboration with communities to increase local capacity to expand the ability of HIV testing in health centers, emergency departments, substance abuse prevention and treatment programs, mobile units, as well as community-based organizations and non-traditional settings such as a bar, parks, and during community festivals. The next pillar is to treat people with HIV rapidly and effectively to reach sustained viral suppression. People with HIV who take HIV medication as prescribed and stay virally suppressed can live long, healthy lives and have effectively no risk of sexually transmitting HIV to a partner. CDC estimates the overall viral suppression rate in the United States is approximately 53%. HIV Treatment Guidelines recommends all individuals with HIV begin treatment as soon as possible after receiving their diagnosis. Achieving a viral suppression target requires promptly linking individuals newly diagnosed with HIV to care and treatment, including through rapid start treatment programs. Finding innovative and effective ways to re-engage the estimated 250,000 individuals who are aware of their infection but not receiving HIV care and treatment, and supporting those already in care who have not yet achieved viral suppression to achieve control of the virus. The next pillar is to prevent new HIV transmissions by using proven interventions, including pre-exposure prophylaxis, which is PrEP, and syringe service programs. Health and Human Service agencies will support states and local communities to implement strategies to increase access to and use of PrEP, especially among African American, Latino, gay and bisexual men, African American women, and other populations disproportionately affected by HIV. Health and Human Services launched Ready Set PrEP, a nationwide program that provides PrEP medications at no cost to thousands of individuals who qualify. Syringe service programs are a safe, effective, cost-saving intervention that does not contribute to illegal drug use or crime. Comprehensive syringe services programs dramatically reduce HIV risk and can provide an entry point for a range of services to help stop drug use, overdose, deaths, and infectious diseases. And the last pillar is to respond quickly to potential HIV outbreaks to get needed prevention and treatment services to people who need them. So we want to have real-time response systems as are key to ending the HIV epidemic in the South. Health and Human Service agencies are working with impacted communities to ensure they have the additional expertise, technology, personnel, and prevention resources to follow up on HIV cases and to intervene to stop chains of transmission and to get those impacted into appropriate care and treatment. So this is a picture of the HIV Toolkit. With the HIV Prevention Toolkit, the HIV mortality and prevention rate should be decreasing, and there should not be any late diagnosis. There are many ways for individuals who do not live with HIV to protect themselves, such as using condoms, taking PrEP, and testing regularly for early detection. So an individual that is living with HIV can protect themselves by taking their antiretroviral medicine routinely each day and using condoms. This will allow them to protect their partner and even achieve a viral load that is undetectable. If you have ever heard of the term U equals U, it means undetectable equals untransmittable. That means a person living who is living with HIV has achieved and maintained an undetectable viral load by taking their antiretroviral therapy daily, and they cannot sexually transmit their virus to others. This overall strategy is called treatment as prevention. Another strategy is testing. People who have a higher risk should get tested every 3 to 6 months. People who are at lower risk should get tested before having sex with a new partner for the first time and after ending a relationship. PrEP is another strategy, and it is a medicine that can be given to people who engage in risky behaviors to reduce their chances of getting HIV. Okay, sorry. So next, I'll talk about the impact of HIV. So some of the negative impacts is social isolation, which can cause a lack of engagement with peers in their community. Next is stigma, and then next is a negative impact of mental health and substance use for those without a support system. And substance use can lead to a person continue to engage in risky behavior. Many who use substances can have co-occurring mental health disorders that drives their substance use. Housing and job risk because of stigma. An employee may not want to hire an individual or continue to let them work if they know the person's status. That can cause the individual not to be able to support themselves, which can result in the individual becoming homeless. Positive impact is a person may show resilience by showing people that they are able to live long, healthy lives. The person may also become an activist and work towards reducing stigma related to HIV. So now we'll talk about HIV in the youth. So as I mentioned earlier, 21% of new HIV diagnoses are among youth aged 13 to 24 in the United States in 2018. Most new HIV diagnoses among youth were among same-gender loving and bisexual men. And more than half of young same-gender loving and bisexual men who received an HIV diagnosis were African American. In 2018, an estimated 1,173,900 people live with HIV, and among those, 47,800 were youth. So some of the, there are many factors that can increase and decrease the risk of HIV depending upon the type of exposure or behavior that the individual is engaging in. So substance use, when a person is drunk or high, they are more likely to take risks, such as having sex without a condom. In 2019, 21% of sexually active high school students drank alcohol or used drugs before their most recent sexual encounter. The next risky behavior is condom usage, and using condoms or taking medicine to prevent or treat HIV are highly effective HIV prevention options. In 2019, 46% of sexually active high school students did not use a condom the last time they had sexual intercourse. The next behavior is multiple sex partners. The more sex partners a person has, the more likely they are to have sex with a partner who has HIV or another sexually transmitted infection. In 2019, 9% of high school students reported sexual intercourse with 4 or more people during their life. The next behavior is sexual behavior. A person can get or transmit HIV if they have sex without using HIV prevention options like condoms or medicine to prevent or treat. In 2017, 13% of young same-gender loving and bisexual men with HIV reported having receptive anal sex, and 9% reported having insertive anal sex without a condom with the most recent sex partner in the past 3 months. Also, do not forget that women and girls can still get HIV from sex as well. And my last risk behavior is injection behavior. Sharing needles, syringes, and other drug injection equipment puts people at high risk for HIV and other infections. In 2018, 48% of youth reported using a syringe after someone else, and 72% of youth reported using an injection equipment after someone else used it in the past 12 months. So there are several challenges that the youth face that makes it difficult for the youth to access the tools that they need to reduce their risk of getting treatment and care if they have HIV. So first one is low rates of HIV testing. HIV testing rates among high school students are low. People who do not know that they have HIV cannot take advantage of HIV care and treatment and may transmit HIV to others without knowing. The next challenge is social and economic. Among people with HIV, young people are more likely than older to live in households with low income levels, to have been recently homeless, recently incarcerated, or uninsured. These factors pose barriers to achieving viral suppression. Next challenge is low rates of PrEP use. Young people are less likely than adults to use medication to prevent HIV. Barriers include cost, access, perceived stigma, and privacy concern. The next challenge is high rates of other STIs. Some of the highest STI rates are among youth aged 20 to 24. Having another STI can greatly increase the chance of getting or transmitting HIV. And the last challenge is inadequate sex education. Sex education is not starting early enough. There were not any states that reported that their middle schools teach all 16 sexual health topics recommended by the CDC. The percentage of US middle schools in which students are required to receive instruction on HIV prevention decreased from 82% in 2000 to 71% in 2016. So next I'll talk about the impact of HIV on the youth. So for mental health, there is a loss of support system. The family could reject them when they disclose their status, and that could of course result in isolation. The struggles with dating, the person living with HIV may find it difficult to date due to having to disclose their status. They may also struggle with when is the right time to disclose the status. Having to tell others about an HIV diagnosis can cause the individual to have anxiety due to not knowing how the other person will react. And stigma, there are many negative stigmas that are related to HIV, like the person is promiscuous, a drug user, or dirty. This can cause the individual to not want to disclose their status. For physical health, the youth may not know that they have HIV due to the parents not disclosing it to them. This can cause an impact on the adolescent who is living with HIV and others who are not living with HIV. An example is if you are dating, or if you are dating, you and your partner are dating, and you both decide to have sex for the first time, you're both virgins, and you unknowingly transmit it to your partner without even knowing. So that's how it can affect both. So schools can play a critical role in helping prevent HIV. They can teach students about HIV and other transmitted infections. They can do this by enhancing HIV prevention by including information and procedures for obtaining free or low-cost testing and other health services. Also, hopefully, educating students will increase the likelihood of being tested. They can promote communication between youth and their parents about HIV. And by doing this, they can provide families with information and skills they need to support healthy attitudes, behaviors, and environments. Also, help families identify a unique opportunity to have the conversation with their students. And last, they can support students' access to confidential HIV counseling and testing services. So they can establish a referral system that helps link students to youth-friendly healthcare providers and raise students' awareness of the need for and availability of health services. So what can you do? It is important for young people to understand their risk and know how to protect themselves. So get educated, learn the basic facts about HIV transmission, testing, and prevention. Get talking. Talk with parents, teachers, doctors, and other trusted adults about HIV and sexual health. Get tested for HIV. CDC recommends that everyone between the ages of 13 and 64 years old get tested for HIV at least once as part of routine health care. Get medicine. If you tested positive for HIV, get support, seek treatment, and stay in care to remain healthy and prevent passing the virus to others. Families, schools, and community-based organizations such as the Alabama Campaign for Adolescent Sexual Health, school-based organizations, and health centers must work together to provide safe and nurturing environments for the youth. Any questions?
Hey, Delisia, thank you so much for all that information. That was great. I did have one question. You talked a lot about stigma existing for different, for folks that have HIV, or even the stigma of just getting tested. Can you talk a little bit more about what those stigmas are, what they look like, and yeah, why the stigma exists?
So some of the stigmas that when I was researching, I just found out that I know for obviously, feeling dirty, people think you're dirty, just how people look at you. I realized that was one of the biggest stigmas that I saw. Mm-hmm. And so you don't want, and I guess when you tell somebody, they look at you like they don't want to be around you. So that's one of the biggest stigmas I can think about. But I know that it obviously can affect the person mentally, because it can result, of course, in the isolation.
Yeah. I was just curious if there was, I know you talked a little bit about about job loss or potential job loss and housing loss. And I know that there's a lot of stigma and bias towards people that have HIV that would, result in them losing their job or potentially losing their housing because of those misconceptions we talked about earlier too. So yeah, that's helpful to know. There's just, still so much misinformation, I guess, that folks don't know what HIV is and how it's passed. And so it results in the stigma. And Dr. Hill is saying, lack of accurate, up-to-date information is a big cause of stigma. Yeah, absolutely. And of course, from our stance as the Alabama campaign, we really appreciate you putting in there, that one of the reasons we have high rates of HIV is, of course, because of the lack of sex education, because that's the primary work that we do as well. Are there other questions? I
had a question.
Yeah.
Do you think that one of the things that when we talk to some of the teens that are in our teen parenting program, of course, there are already many of them are having unprotected sex, but I think there's still a perception because the medications are there and they are working well, and people with HIV are able to live, if they're on their medication and it's well controlled. That fear factor is not necessarily there with a lot of the teens. And I think that there's still a lot of risky behavior because they're not seeing it's not that big bad wolf, that scary thing to them anymore. And I'm just wondering, what are some ways that organizations that serve teens can still get that message across that this is still a serious disease?
I would say just, I guess, trying to figure out ways to educate them. Not really quite sure how that can be done, but that's what I'm thinking.
I can help you.
Thank you.
I was just curious of what some other organizations might be doing, because to make them more aware that that they're engaging in risky behaviors that could really impact their health.
Okay, thanks, Christina. I think so. I'm Samantha. I actually work with youth living with HIV as well as those that are not. And I think to answer your question, Mona, a lot of it is just exposure. So it's interesting when I have to tell someone that they're newly diagnosed with HIV and they're young. You're correct. Half the time, like, oh yeah, I know about HIV. I'm not too concerned, which is a good thing because it means in their bubble or their social network, the stigma is lower. But they don't recognize like the amount of the pill, like the size of pill, something so simple as the size of pill. The pills that we use to treat HIV are huge. They're the equivalent of horse pills, to be honest. Or the fact that they have to come in for visits all the time. So like maybe even using some of those kind of strategies and more so having them talk to someone that's actually living with HIV, that's closest to their age, just to share like, yes, I'm living and I'm thriving, but I had to change my perception about my responsibility and how I interact with health. And I have to like, sometimes I can't go to practice because I have to go to my appointment, that kind of thing is something that you could do if you're actually working with these girls in your organization.
Okay, thank you.
Mm-hmm.
Thanks, Dr. Hill, and thanks for the question, Mona. Yeah, I think that it's great to, not maybe have so much of that fear, but there is, and I don't prescribe to fear as a motivator, but you still do want young people and all people to be aware of the responsibility, which I think is what the word that Dr. Hill used, the responsibility towards their health and the health of their future partner and the health of their future children potentially in having an HIV diagnosis. So that may be a motivator. So I'm so sorry that this has happened again, but it looks like we're about to get kicked out in like 1 minute from this Zoom. I have no idea what's going on with my account, but I will address it before our January meeting or what January webinar. But I want to thank you all so much for being here, and especially Delisia, thank you so much for presenting for us today. It was Delisia's first time doing a professional presentation. I think you did a wonderful job and it gave such great information. So thank you for being here, everyone. Thank you, Delisia, for presenting for us. And this this recording will be available on our website, and I'll send an email by the end of the week with an evaluation for y'all to fill out as well. So thank you, happy holidays, and we'll see you in the new year.
Great, thank you.
Thanks, Christina.
Thank you.
Thank you.